Good morning. Pat Gardner and Senator Nan Orrock is my name, and we're going to hear from Representative Pat Gardner as well as other organizations who are supporting these initiatives. We have come together to introduce in the House and Senate the legislation that would start us down the road to create a health insurance marketplace for consumers and for small business here in the state of Georgia. We need to move ahead as a state and be prepared to take the next steps to have more Georgians insured, small business better served, and have the Affordable Care Act mean something here in Georgia. This is a very simple concept, and it's one that a Blue Ribbon Commission has worked on throughout the year. Millions of Americans, millions of Georgians, and small business owners find trouble finding affordable health insurance. Now they'll be able to purchase it in a fair marketplace called the exchange, just like the one that members of Congress use. And this is a proposal that we're making that reflects the findings of the Blue Ribbon Task Force that worked all year. In a Georgia insurance exchange, insurance companies will compete to provide the best product at the best price. And tough rules will make sure that every insurance package covers the basics, like annual checkups and preventive medicine. The competitive healthcare marketplace brings real competition and greater transparency to the insurance industry, and that's going to work to bring down consumer costs. Small business across Georgia has been asking for us to move forward. There are so many people who don't have any good way to find coverage for themselves as individuals. That's why we're bringing this legislation to you today. It's consumer protection legislation with strict standards for insurance companies who want to be involved. It levels the playing field, and it allows individuals and small businesses looking for insurance to join together with others like them to negotiate for group rates and discounts the way the large companies currently do. We're trying to level the playing field and give folks a fair shot at having health insurance here in Georgia. And even if you don't plan on using the insurance marketplace, it'll increase competition among insurance companies and help lower premiums for everyone. So, yes, we stand here in favor of the Affordable Care Act at the federal level, but we say today loud and clear, Georgia needs to step up to the plate and do what's in the best interest for our citizens, get more people covered with health insurance, and have standards for the health insurance marketplace that truly serve consumers and protect and encourage competition for consumer health dollars. We will be healthier as a state when we move forward, and we really don't see any need to delay this. It's unfortunate that the governor has chosen to not move forward with creating the health insurance exchange. And I would say to you that our insurance commissioner, Georgia's insurance commissioner, has repeatedly said the legislature should get this done this year. We need to be ready in Georgia. And states that do not set up their health insurance exchange, their health insurance marketplace, will then have the federal government run insurance marketplace for the state. You choose. We think Georgia should establish the marketplace for insurance for consumers and for small business. And we should do it now. Why delay? I'm going to introduce Representative Pat Gardner to speak about the bills that she has really been a very primary author of. It's Senate Bill 418 and it's House Bill 801. So let me introduce a colleague that I'm very proud to work with, who is truly has deep expertise on health issues, has worked in the health field for some 35 years, and served on the Blue Ribbon Task Force on creating the Georgia health insurance marketplace. So let me bring Pat Gardner and her expertise.
You know, this summer there were a lot of meetings, and Georgia's small businesses from all over the state came to let us know that their number one business issue was to be able to provide for their workers. They would like to provide health insurance for their workers, but they find it very difficult to find an affordable and comprehensive policy. In these bills, we've created something called the Georgia Health Insurance Marketplace Authority, which will create a clearinghouse It will provide more options for small businesses to offer to their employees. Instead of just one insurance company, you will be able to choose from a variety of plans and several different insurance companies. We think that's important for competition. Regardless of the challenge to the Affordable Care Act that's going on in Washington, this marketplace is needed in Georgia now. And Georgia must create its own exchange or marketplace. We don't believe it is in the best interest of Georgia's citizens to operate under an exchange or a marketplace that is set up by the federal government. Even the insurance commissioner has agreed with us on that particular topic. If no bill passes this session and the Affordable Care Act is upheld, only states with bills in place regarding it setting up a health insurance exchange will be able to receive federal fundings to set up the exchange. We don't think Georgia should be at the back of the pack. We believe we should be leaders in setting up this marketplace. We believe Georgia needs to take the steps as we have described and set up this act in this session. We need to do it now. It is unfortunate that our leadership feels the need to be so cautious. Very frustrating to those of us who worked all summer on a committee to set up the exchange. And if you were to go to georgiahealthreform.gov, you would find the report of the commission that recommended going forward with a quasi-governmental agency, the Georgia Health Insurance Marketplace Authority, regardless of what happens at the federal level. Thank you so much for your interest in this topic.
Good afternoon. My name is Amanda Ptashkin, and I'm the Outreach and Advocacy Director for Georgians for a Healthy Future. We're a health policy and advocacy organization that provides a voice for Georgia consumers on vital and timely health care issues. Our mission is to build and mobilize a unified voice, vision, and leadership to achieve a healthy future for all Georgians. I'm honored to be here today to support Senator Orrock and Representative Gardner's legislation, and believe that these bills will go a very long way in helping the approximately 1.9 million uninsured Georgians by creating a health insurance exchange or marketplace. The idea behind the exchange is to provide a way for consumers who do not have a plan provided by their employer to access affordable health care. Today, approximately 350,000 Georgians purchase individual health insurance plans. Individuals and families will be able to purchase insurance on the exchange, regardless of whether they have a pre-existing condition, and will enjoy the peace of mind that plans will be certified and offer strong consumer protections. The exchange will be a one-stop shop for consumers to evaluate their insurance options, make apples-to-apples comparisons of plans in plain language, not in insurance jargon, and purchase the plan that is right for themselves and their families. For individuals and families with incomes up to 400% of the federal poverty level, there'll be tax credits that can be applied directly to their premiums at purchase. For individuals and families with income below 133% of federal poverty, they will be eligible for Medicaid and able to enroll in that program through the exchange. There will be no wrong door. Here are some of the key ways in which a state-based exchange could benefit consumers. It'll add transparency to the marketplace by providing information about insurance options in an easy-to-use format. It'll make insurance more affordable through tax credits and other help with co-payments and deductibles. It'll provide navigation and assistance, not only with enrollment, but with questions and grievances. It will provide information and tools to help consumers make informed choices and determine eligibility. And it'll increase competition based on value and hold insurance companies accountable by certifying that plans meet standards regarding provider networks and benefits. We have a very real and tangible opportunity to help Georgia consumers by moving forward in the creation of a state-based health insurance exchange. With 1.9 million uninsured Georgians, this could not come at a better time or when more is at stake. Thank you for the opportunity to speak.
Yes, I am Kathy Floyd with AARP Georgia. We have right at 1 million members in the state of Georgia, and those 350,000 people that currently have individual health insurance policies, many of those folks are in their late 50s, early 60s, and were downsized or retired or started their own small business, and they no longer had access to a group insurance plan. And so they go out on the individual market, and if they have any kind of pre-existing condition, those policies can be outrageously expensive. And so you have people that are constrained in running a small business and starting a small business. We have members that are in a job wanting to start their own small business, but they're stopped by the fact that they cannot get affordable access to an individual health insurance plan. We also have heard from members that are looking to possibly retire when they're 62, 63, 64, and they want to have a marketplace that they could buy individual health insurance to give them a bridge to Medicare, because Medicare is not available until you're 65. And so the people that are in their early 60s are in a real bind if they choose or involuntarily get out of a group health insurance plan. It can be a really bad situation for our members. And we were very supportive of the recommendations that came out of the governor's task force to set up this health insurance exchange. The marketplace idea is actually a Republican idea, and so it really is unfortunate that partisan politics have gotten into this when the Georgians are the ones that suffer for that.
Hello, we're standing here together to support Senator Nan Orrock and Representative Pat Gardner, because we believe this is the legislation that all of Georgians need, but particularly women who are disproportionately impacted, certainly by this economy. Women have lost more jobs. We are left without any employer-based insurance, and also women actually are leading in starting their own small businesses. So we see how this marketplace would definitely benefit them. We don't think we need to wait. We would prefer a Georgia-driven marketplace for health care and think that we have the capacity to define what that's going to look like. Thank you so much.